Good day, colleagues. My name is Pavel Gavrilov. I'm the moderator at Tomopraktika channel. Let's get started. Today, I'd like to talk about one of the more specific CT findings when evaluating liver lesions, the so-called double target sign. So, how does this sign actually look? Think of it as a target pattern. In the center, we see an area of low density. This may represent pus, necrosis, or simply fluid. Around it lies a bright inner ring of contrast enhancement. That's the rim of granulation tissue. And outside of that, there's a broader zone of low density, which reflects edema in the surrounding parenchyma. Altogether, this mirrors the morphological structure of inflammatory processes on CT. Here on the image, as you can see, the low density center is very clear. Then, indicated by the blue arrow, is the enhancing inner rim. And finally, marked with the yellow arrow, you see the wider outer halo of edema. This is actually a relatively young radiological sign. It was first described in 1985 in patients with liver abscesses on contrast-enhanced CT. It's not very common, seen only in about 30% of cases. But importantly, it does not occur in other hepatic lesions. Later, in 2012, another study confirmed both the sensitivity and specificity of this sign. According to those authors, it's one of the key diagnostic indicators of a liver abscess. Again, it doesn't appear in other liver diseases. The limitation, however, is clear. We only see it in about a third of abscesses. In chronic liver abscesses, the sign can still be present, but with some differences. The central necrotic zone may look heterogeneous. The capsule becomes more prominent and sometimes even calcifies, and the perifocal edema may be less pronounced or absent altogether. So let's sum it up. The double target sign is a reliable criterion suggesting that the liver lesion is an abscess. If we don't see it, we cannot rule the diagnosis out. And as always, CT findings must be interpreted in the context of the clinical picture. Dear colleagues, thank you all for your attention. I hope this short overview will make your everyday practice a little easier. Thank you.